The deadliest disease, pancreatic cancer. Did you know that pancreatic cancer has a survival rate of just 7.2%? That's lower than the odds of surviving a plane crash. In fact, pancreatic cancer is so deadly that only 1 in 10 people diagnosed with the disease will survive the next 5 years. To make matters worse, there are about 100,000 new cases and deaths of pancreatic cancer reported every year. This brings us to the question, what is pancreatic cancer and why is it so deadly? In this video, we'll be discussing everything you need to know about pancreatic cancer and its risk factors. We'll also cover emerging treatments to help treat pancreatic cancer. So let's get started. What is pancreatic cancer? The pancreas is a vital organ located deep in the abdomen. It is responsible for producing essential digestive enzymes and hormones like insulin. Pancreatic cancer occurs when cells begin to multiply and spread uncontrollably in the pancreas. When cancer takes hold, it can disrupt the function of the pancreas and wreak havoc on the body. There are several types of pancreatic cancer. The most common form is adenocarcinoma, which accounts for about 85% of all cases. This aggressive disease spreads rapidly to nearby organs, including the liver, stomach, and small intestine, making treatment a daunting challenge. Why is pancreatic cancer so deadly? For starters, it's often diagnosed at a late stage, when the cancer has already spread to other parts of the body. Symptoms can be unclear and nonspecific, making it difficult to detect early on. Even when diagnosed early, pancreatic cancer cells possess an uncanny ability to rapidly adapt and mutate, developing resistance to chemotherapy and radiation therapy, which are the very treatments designed to eradicate them. This is why the 5-year survival rate for individuals diagnosed with pancreatic cancer is relatively low when compared to the other forms of cancer. This dismal survival rate has earned pancreatic cancer its notorious reputation as one of the deadliest forms of cancer out there. Prevalence. Pancreatic cancer isn't very common, but it's incredibly lethal. It makes up about 3% of all cancers in the United States, but is the cause of 7% of all cancer deaths. With an estimated 60,000 new cases in the United States each year, pancreatic cancer stakes its claim as the 11th most common cancer. Risk factors of pancreatic cancer. Older adults are at the highest risk of developing pancreatic cancer, with more than 90% of cases found in people aged 55 and above. As we age, the protective ends of our cells, called telomeres, shorten, making our DNA more vulnerable to damage. This damage can lead to genetic mutations, which can spark the growth of cancer cells. As we grow older, keeping an eye on symptoms and regular diagnosis becomes very important in the battle against pancreatic cancer. However, age is just the beginning. Obesity and physical inactivity can further contribute to pancreatic cancer. Excess body fat promotes the production of hormones and growth factors that stimulate cancer cell growth. Obesity can also cause prolonged inflammation that can cause DNA damage and encourage the growth of abnormal cells, thereby increasing the risk of cancer. Smoking is a notorious cause of many diseases. It is a key risk factor in pancreatic cancer's development. Individuals who smoke have a 66% higher risk of being diagnosed with pancreatic cancer versus non-smokers. Individuals who smoke expose their body to carcinogens that directly damage DNA and spark cell mutation. When it comes to gender, men are slightly more likely to develop pancreatic cancer. A family history or genetic syndromes like BRCA2 can also significantly increase the risk of developing pancreatic cancer. Despite these risk factors, over 20% of cases have no known causes, making this disease a silent assassin that can strike anyone at any time. Current research efforts related to pancreatic cancer. In the quest to conquer pancreatic cancer, researchers are pushing the boundaries of innovation. As we speak, hundreds of clinical trials are underway, testing new treatments and combinations of treatments. From detecting the disease at its earliest stages to developing personalized therapies, the medical community is leaving no stone unturned. Early detection is critical. Scientists are working tirelessly to develop screening tests that can easily identify pancreatic cancer before it's too late. They're studying genetic mutations, protein biomarkers, and even as far as exploring whether a blood test can detect pancreatic cancer in people with new-onset diabetes. Treatment options are also being revolutionized. One of the most promising areas of research is immunotherapy, which harnesses the power of our immune system to fight cancer. Scientists are developing new drugs that can stimulate the immune system to attack pancreatic cancer cells, such as checkpoint inhibitors and cancer vaccines. Another exciting area of research is targeted therapy. Targeted therapy involves designing drugs that specifically target the genetic mutations driving pancreatic cancer growth. For example, researchers are developing drugs that target the KRAS mutation, which is present in over 90% of pancreatic cancer cases. Gene editing technologies like CRISPR are also being explored as a potential tool to treat pancreatic cancer. By editing out the genetic mutations that drive cancer growth, scientists hope to develop a new generation of cancer therapies. With continued innovation and collaboration, we may finally be able to conquer this deadly disease once and for all. Challenges associated with early detection of pancreatic cancer. Despite the technological advances, detecting pancreatic cancer early remains a significant challenge. Due to its aggressive nature, symptoms often appear only when the tumor has progressed to an inoperable stage. While early detection could dramatically improve survival rates, several challenges hinder early diagnosis. One major challenge is identifying those at risk of developing pancreatic cancer. It's like trying to predict a lightning strike. We know it can happen, but we don't know when or where. Certain groups are more prone to the disease, such as those with a family history of pancreatic cancer, pancreatitis, or mucinous pancreatic cysts. But even within these groups, detecting the disease early is a difficult task. Imagine trying to detect a tiny tumor in the pancreas, an organ hidden deep in the abdomen. It's like finding a tiny ball in a large field. For this reason, specialized tools, like biomarkers and imaging modalities, are needed to help detect pancreatic cancer early. But even with these tools, the task is far from easy. Recent advances in imaging modalities, such as CT and MRI scans, have improved our ability to detect pancreatic cancer. However, these modalities are not foolproof, and the disease can still go undetected. That's why there is a need for continuous innovation to develop new tools and strategies that help detect pancreatic cancer early when it's most treatable. Treatment options for pancreatic cancer. From surgery to chemotherapy, radiation therapy, and immunotherapy, the treatment options are diverse and powerful. The key is to know which treatment to use and when. For patients with early-stage pancreatic cancer, surgery is often the first line of attack. By removing the tumor and surrounding tissue, surgeons can give patients a chance to achieve remission. After surgery, chemotherapy and radiation therapy are the next lines of defense. These treatments use powerful drugs and energy beams to destroy cancer cells. Moreover, with the development of targeted therapies and immunotherapies, we can attack specific molecules and unleash the immune system to fight the disease. Nevertheless, the best treatment plan is not a one-size-fits-all approach. It's a personalized strategy that takes into account the patient's unique genetic profile, medical history, and lifestyle. It's like a tailored suit designed to fit each patient perfectly. Breakthrough treatment for pancreatic cancer. The continuous research for effective treatment options has led to groundbreaking discoveries and innovative therapies that offer a beacon of hope for pancreatic cancer patients. Neoadjuvant therapy, a revolutionary approach that combines chemotherapy and radiation therapy before surgery, has shown promising results in shrinking pancreatic tumors and increasing the chances of complete surgical removal. This approach has been pioneered by experts like Dr. Devendra Sohal and Dr. Syed A. Ahmad from the University of Cincinnati Cancer Center, who have been instrumental in conducting clinical trials. And that's not all. Scientists at the University of California, San Francisco have made a groundbreaking discovery that could potentially turn pancreatic cancer into a treatable condition. Researchers have made a significant breakthrough by designing a candidate drug targeting the infamous KRAS G12D mutation. This mutation is responsible for nearly half of all pancreatic cancer cases. It has long been a major obstacle in developing effective treatments. Dr. Kayvon Shokat's team has successfully created a molecule that selectively targets and binds to the mutation, inhibiting tumor growth in both cancer cell lines and animal models. This advancement opens new possibilities for treating pancreatic cancer. With these breakthrough treatments, we are one step closer to winning the fight against pancreatic cancer. Pancreatic cancer is deadly. With limited early screening options, it is important to seek medical care immediately if you or someone you know is at risk. Thanks for watching. Don't forget to subscribe and click on the video showing on your screen right now to learn about another important topic for a healthier, happier you. See you there.